If you're dealing with chronic Lyme disease, you probably know the feeling. It's that internal vibration, the burning sensation, the brain fog that feels like static on a radio. You go to your doctor and they check your blood work and they tell you the infection's gone. They might even tell you it's all in your head. It's not in your head, it's in your nerves. You see, here's the problem. The medical system is fantastic at acute trauma. If you break your leg, you go to the ER. If your heart attacks you, you go to the ER. But for chronic disease, they're trained to manage symptoms, not fix the wiring. And when you have Lyme, the infection attacks your nervous system. Even after you kill the bug, the damage to the electrical wiring in your body can remain, and it's called an interference field. Most doctors treat the chemistry with antibiotics, but they ignore the physics, the electricity. We have a clinical secret at the West Clinic. It's not new. It's been used in Germany for over 100 years. It was developed by the Huneke brothers, their doctors, in 1925, and it's called neural therapy. And we don't use metaphors here. Let's talk biology. Your cells function like a 1.5 volt battery. When you have trauma from a Lyme or surgery scar, maybe a vaccine or an injury, that battery loses its charge, it stops pumping out toxins. It creates a short circuit in your autonomic nervous system. Now this system controls everything, your heart rate, your digestion, and healing. And when it's short circuited by the Lyme bacteria, you stay in fight or flight mode. You can't heal, especially in that state. So this is how we fix it. We use a specific substance that's a glycolized ether of para-aminobenzoic acid. Man, that's a mouthful. But here's what it does. It really helps the nerves to open, close, and reboot. But it's not just numbing. Like at first you get the really mild numbing sensation, and when injected into specific interference fields, like scars or chronic pain areas or around nerve clusters, what it does is it resets the cell wall voltage. It turns on the iron pumps back on, and it reestablishes the electrical connection. It's not about masking the pain. It's about restoring the flow so the body can actually heal the tissue. Now I have patients coming here with severe migraines, frozen shoulders, numbness, autoimmune problems, or other symptoms from Lyme, and we identify those as interference fields. And sometimes it's a scar from a surgery that can happen years ago that is short-circuiting the meridian, and we treat it with this neural therapy. And the results? Often we see immediate improvement, not only in symptoms, in range of motion, in pain reduction. I've seen it really help organ function. And when we see that fight or flight system turn off and the rest and digest system turn on, this allows your sleep to improve and your anxiety to drop. You might ask if it's safe. This is one of the oldest, safest medications in history. It's called Procaine. It metabolizes into PABA, which is type of a D vitamin, and something called DEAE. It's extremely safe. The most common adverse reaction is a little soreness at the injection site, a bruise, or a temporary emotional release because we're unlocking trauma that's stored in the nerves. It's low risk, high reward. So why is your doctor doing this? Well, because it takes time. It takes a detailed history. And quite frankly, it doesn't fit the pill for every ill business model. Now at the West Clinic, we have 110 years of history. We don't just dabble in this. We combine neural therapy with target-specific nutritional therapy. We do vitamin infusion treatments. We do hormone precursors, biopeptide regulators, and personalized nutrition to give you fuel that needs to help hold that electrical reset. If you're tired of managing disease and want to start healing your nervous system, then we should talk. We can support you whether you come to our clinic in Idaho or work with us virtually. You can go to www.lymefighter.com and fill out the application. Let's see if you're a candidate for this treatment. There's no charge for the application. Just put in the information and let's figure out if this is a viable option for you. I'm Dr. Jason West, and I'll see you on the next video.